Well, aloha and good morning. It is Monday, June 8th here in Hawaii. This is the COVID-19 care conversation on the Honolulu Star-Advertiser Facebook page. My name is Ryan Kalei-Suji, joined by, of course, Yunji Denise. And we want to thank, first off, our sponsors, Hawaii Pacific Health and the Hawaii Executive Collaborative, for bringing this conversation forward. We've been doing this now for a few months now. We're starting yet another week. And really, it's a way to engage our community, to provide you, the viewers, information and connect you with some of our leaders. And today, we, of course, have a special guest, not one, but two, actually, special guests that will be joining us today.
That's right. We're going to be hearing from Governor David Ige, as we do every Monday. And we're starting a new feature on Monday. We'll be inviting a guest from the Hawaii Data Collaborative. They are talking about what's going on with the coronavirus here in Hawaii, and talking about specifically data-driven decisions when it comes to controlling the virus and meeting the needs of our community. So we're very excited for that. That's going to be following the governor. As we always do, we start with the count, and we had kind of a mixed weekend, Ryan. Yesterday, just 2 cases, but Friday and on Saturday, 9 cases on each day.
That's right. We saw that increase in numbers. Some saying it is sort of the carryover from the Memorial Day weekend. To talk a little bit more about those new numbers is Governor David Ige, of course. We want to thank Governor for being here. Governor, let's start off by talking about those case numbers, 9 cases on Friday, Saturday. Are you worried at all about those types of numbers? And what are your thoughts overall about some of those increases?
No, certainly we do believe, Ryan, that it is an afterfact of the Memorial Day weekend. I think we saw where so many went out and were enjoying the weekend and being out and about in a way that we haven't seen for a long time. So it was expected, although, having clearly 9 counts on each of those days were a little bit higher than what we might have hoped for. But I think today's count and Tuesday's count will really give us a better idea of what the impact of a Memorial Day weekend was, and we feel pretty confident that we have systems in place that can handle those kinds of counts.
Let's talk a little bit about some of the events over the weekend. Across the country, we've been seeing a huge swell of protests and civil disobedience when it comes to responding to the tragic deaths of George Floyd and Breonna Taylor and others. Here in Hawaii, we saw some big demonstrations as well. My guess is that you could probably see those from outside your window. What did you think of those protests this weekend?
Certainly I was very impressed by the protests, especially because they were so peaceful in how they were organized, and clearly I think everyone in Hawaii joins with the protesters in really wanting to highlight the fact that racial inequalities is still part of our community in spite of progress made all across the country. And we all are committed to doing better. And I think that was what those who participated wanted to say. And I think, as I said, I think everyone in Hawaii joins them in that, making that statement.
Those numbers for this crowd, upwards of 10,000, they're saying, that gathered specifically on that Saturday march. Do those types of numbers, as we deal with, of course, COVID-19 in the state of Hawaii, do those sorts of large gatherings concern you? And what are your thoughts about the amount of people? I mean, we've been talking about for months to limit those large gatherings, yet 10,000 people showing up in one area. Are you worried about that at all?
I certainly am worried, Brian. And I think, for all of us who've had to deal with COVID-19 now for several months, just seeing the sheer numbers and how closely packed together they were certainly is a concern. And I just want to talk to any of your viewers who are part of that. I certainly would ask you to self-isolate yourselves for a couple of days to make sure. And clearly, if you do become symptomatic, don't hesitate in getting services. And then finally, I would encourage them to stay away from any kupuna or loved ones that they have who may be in that high-risk category. We are learning more about this virus every day. And certainly it seems like younger people don't get ill the way that older people do. And many of them may be asymptomatic and unaware that they're carrying the virus and the infection. So certainly, I did see a lot of young people in the crowd on Sunday, and certainly would encourage them to just be mindful and aware that they may be asymptomatic, and and that would be the last thing I think that anyone would want to do, is infect a kupuna or an auntie or uncle who are very susceptible to the disease.
We want to bring in the audience as always. Lake Maddow is speaking for a lot of folks on here, saying, please ask him the question that everyone wants to know. When will mainland tourists be allowed back into Hawaii without the quarantine? Will you require a test? We've heard a lot of different terms tossed out there about this whole travel with aloha concept. But to Lake's question, is there a date that you're looking at? We know Interisland is scheduled for in about 10 days from now, I believe. What is the date today? Today's the 8th, so less than that, on the 16th.
Yes.
So that's coming up. But when are we going to welcome our mainland and international visitors?
Certainly, Yanji, I was looking through what's happening all across the country in terms of COVID-19. And those states that are most important to me are actually seeing their highest levels of COVID activity. California, Utah, Arizona, Nevada, they all had one of their highest virus counts this past weekend. So I think that that's what's very concerning to me. And just a reminder, that the rest of the world has shut down travel from the U.S. because of the virus activity that other nations see in our country. And so certainly, we want to be careful about doing that. And, I don't anticipate that we would allow, domestic travel, certainly not before the end of June. And we're looking at and trying to announce decision parameters that we would be looking at, especially as we look at virus activity in California, Arizona, Utah, Colorado, all of those areas that we see a lot of visitors from.
There's been a lot of talk about the travel bubble and efforts to maybe start this passageway between Japan, Australia, New Zealand. And we talked to Peter Ingram on Friday, the CEO of Hawaiian Airlines, who said that it would be a great start, but for them as a company, just relying on those three markets would be very difficult for a company like Hawaiian Airlines to be able to survive this. They're going to need more than just these travel bubbles. What are your thoughts on just that whole concept of the travel bubble, and will that be effective enough to sort of help not only the hotel airline industry, but the hotel industry as well?
Certainly, Brian, I wish it was different, right? I wish that the United States had taken collective action and really shut down travel to everywhere, because that would put us in a better place. But because every state acted independently, and you can see the virus, and it was definitely raging on the East Coast and New York and Michigan and Massachusetts, and those places were really raging. And now when you look at those communities, the virus counts are coming down, the mortality rate is coming down all throughout the East. But what has now happened is because the shutdown wasn't complete, as I said, we are seeing on the West Coast, the virus is raging. California had its highest counts, Phoenix, Arizona, Colorado. So, I think that that's the challenge. We are committed, talking with the mayors, to keeping our community safe, and travel from the U.S., especially from California and some of those locations, are really, the virus is raging right now. And certainly it would be a significant risk to allow travelers unimpeded, unlimited numbers to come into our state.
Shifting gears a little bit, we saw the news over the weekend about Director Murakami taking some leave. Monique Delgado has a question about that. She says, can we please get more unemployment help with the director on leave? Can we please get longer help for rent, utility production going forward, as many of us can't expect to go back to work due to tourism and the lack of work. Many don't want to lose our homes when we're home teaching our kids also. I mean, this is it's a multi-layered question because it's a multi-layered problem. But first things first, the director is on leave, but obviously the unemployment office is still up and running.
Yes, absolutely. And you know, I continue to stress in my cabinet meetings that those who have volunteered to help out with unemployment insurance should prioritize helping out in the UI office as top priority so that we can keep the people who have actually gotten very good at dealing with the unemployment glitches that we've seen. Let me just assure you that that everyone is committed to keeping it a priority as we drive down the backlog of cases. And then, yes, you know, I am preparing another emergency proclamation that deals with evictions. You know, we are looking on the mortgage side as well, trying to think about what would make the most sense in terms of providing community members relief on the mortgage side. It is a lot trickier and harder. It's obviously a different kind of contract. And so we do understand, and I do hear it from many people all across the state about the challenges of being unemployed, and then the fact that bills keep coming. And with less income or no income, it really is becoming harder and harder to be here.
One of the other questions, of course, is about schools and that opening up. It seemed like there was a lot of time to prepare for it, but when you look at the calendar, I mean, we seem to be sort of gearing up and talking about schools starting already in the fall. What are some of the things that are happening? And if you could give an update on what the DOE is planning to do to reopen the schools safely, because we're hearing from some teachers about just their overall concern about heading back into the classroom and possibly doing a tiered scheduling. What is sort of an update on schools opening in the fall?
You know, certainly Superintendent Kishimoto is meeting with her leadership team and community members. You know, she has reached out to the private schools as well, just trying to make sure that we have consistent policies, both public and private schools. You know, and they are working through the tough issues about what it would take to reopen schools and what it will look like. You know, I was on a call with the other governors this morning and the vice president, and school reopenings is a big issue all across the country. In many school districts, they actually start July 1st. So they're like 2 weeks out for their start of their school year. And so, you know, definitely some states are a little bit further along. I'll be passing that on to the superintendent. You know, they're looking at a blended kind of environment. You know, we do know that some children thrive in a telecommuting, telelearning kind of environment, and you know, that needs to be part of what's going to happen going on. But we also know that some people, some students, especially, you know, especially coming from single-parent homes. It becomes a bigger and bigger challenge, and especially for the younger children, you know, K through 6, the students really can't be at home unsupervised. So, you know, we are looking at different options about, you know, morning and afternoons, and seeing how we can reduce the numbers on campus. And then really what other health provisions will be implemented. Many school districts are trying to get daily health updates from the students, making sure that any student who's symptomatic just doesn't go to school. And in the same way, faculty and staff as well, you know, want to make sure that anyone who is ill does not get into campus. So that is an ongoing discussion. I know the superintendent is working really hard so we can provide to the general public what will happen with schools in the fall.
I mean, it sounds like you're talking about two big variables, two big things happening at the same time. Opening tourism likely sometime late July, early August, and then school starting right at that same time. Do you worry when you have those big activities happening at the same time that we could see an uptick and then not know what the source is?
Yeah, certainly, Yunji. I think that is the biggest challenge. And, the thing about school reopening is that it can become, an activity that can really spread the virus to many people. Speaking with Dr. Burks on the call this morning, she had said that she did have a chance to review all the data that we've gotten from, the COVID experience all around the world. And the one thing she wanted to make clear to us governors is the fact that, yes, there are very isolated young people who have very serious illness, but it's very, very rare. And that, the young people who get COVID typically are asymptomatic or very mildly impacted, although they can become spreaders of the disease. So, she just talked about the notion that obviously schools are a vital, fundamental service that government provides, and we have to have schools open in order for life to return to normal. So it is about managing the risk, and that there are things that we can do to reduce the risk to everyone involved. And I think that that's part of the package of things that superintendent will be putting together about what schools look like in the new normal with COVID-19.
I want to kind of go back to travel because it seems like the question that we're getting most about. Jenny's asking, we are waiting to plan our vacation around your dates. And so I want to, maybe tie this into another question about Hawaii residents when we travel. We know Las Vegas is now open for business. A lot of Hawaii people, of course, going to the 9th island. But with that comes those risks of Hawaii residents coming back to the state. We were talking about opening up the state to visitors, but as we've seen in the past, a lot of the Hawaii residents were carriers for the disease in the initial outbreak. So what are sort of the plans, maybe not only to open up the state to visitors coming in, but returning residents when they go out on trips? How can they better prepare to plan for their vacation, like maybe Jenny is, but also for other residents that want to come back into the state?
Certainly I would just let people know that if you were to ask me, I wouldn't suggest that you travel to the US right now. It's not a safe time to be traveling, and COVID is still very active in many of the states. And so, I understand the desire to travel for vacation. I just want you to know, and as I went through the data, like I said, California, Utah, Colorado, Arizona, Nevada is having the highest virus counts, amongst the highest virus counts that they've had in this COVID pandemic. So they just need to look at where they're going. And I would certainly encourage them to, there's a lot of public data on virtually every state, and it is broken down county by county. So they really ought to be looking at where they're going to and really understanding how prevalent the virus is in those areas. And yes, Ryan, most of the cases that we've had in the islands is a result of a resident traveling somewhere, getting infected with the virus and bringing it back, and then getting others infected. So anyone who leaves the state of Hawaii upon their return would be subject to the 14-day mandatory quarantine. And I do know that they're in their residence, and so they can, pretend like the quarantine isn't real. But I certainly would encourage them to take the quarantine serious. And really, the worst thing that could happen is they infect a loved one who is vulnerable, who becomes very sick.
Johnston Kimberly says, please ask him why short-term rentals cannot operate and larger hotels can. We are seeing the neighbor island travel resume. People want to go and stay in different places. When do you anticipate opening up those short-term rentals?
The challenge with short-term rentals, as both of you know, typically there's no staff there. And so we are definitely making clear that you can't quarantine in a short-term rental because there's no way for us to validate whether the individual is going there. And remember, quarantine means that you go directly from the airport to the place of quarantine, and you stay in that facility and don't go out for any reason. You know, food needs to be delivered to you. It's not like you on vacation air and you can go to the beach or the pool. Quarantine is because we have a public health emergency, and it's a very infectious disease, and we don't want people infecting others in our community, nor other guests who might be here in the islands.
You know, we know that you usually have a call coming up with the mayor, so we want to make sure that we get you out on time. Maybe one last question about the inter-island quarantine, which is being lifted coming up. What we heard the announcement come last week. What is an update on that? Because I know that you folks were sort of lining things up to prepare for that, especially with the new form that's going to be required. Can you give us an update on some of the steps that have been made to prepare for this inter-island lifting of the 14-day quarantine?
You know, certainly, Ryan, everyone who travels inter-island will be now required to fill in a public health form. And as we said before, it will be their name and their residential address, as well as where they're traveling to, you know, their flight information and where they'll be staying on the neighbor island. And we will ask for contact telephone numbers for us so that we can follow up with them. And then there'll be a general health screening that we'll ask them, you know, making sure that they haven't traveled out of state in the last 14 days and that they are not subject to a mandatory quarantine right now, because we don't want someone who is under quarantine to be traveling inter-island. And we actually have that, the form is complete in hard copy. We actually have a website that we're going to encourage people to fill out the form before they get to the airport, because that will make travel much, much smoother. We hope to be able to launch the website later on this week, and certainly are working with the airlines to make sure that they can contact all of those who do have reservations so that they can get access to the electronic form and really finish and complete it before they get to the airport. That's going to be a real important activity so that we can keep people moving and flowing as easily as possible.
Okay, Governor Ige, thank you so much. I know so many of you are asking, when is the date? When is the date? But it's very hard, obviously, to pin down a date. I know Ryan said that was the last question, but I just would like to know.
Sure, I'm fine.
You know, the neighbor island travel, if that goes smoothly, that starts on the 16th, that's sort of a test case, if you will, of how a larger influx of people would work in our airports. What's the lead time? In other words, you know, to bring something like that up to speed, if it's inviting visitors from the mainland or from Japan or what have you, you'd need some time. I mean, can we say it would be a month? You know, you need a month to gear that up. You need 2 weeks to gear that up. I mean, so just so that people have kind of a range.
So I do think that, you know, obviously a month is the minimum time we're getting from the hotels. You know, the airlines are a lot more flexible, and obviously they do have routes that they're flying. You know, for the most part, most of the flights are virtually empty or not that full. So it's, you know, we believe the airline needs probably 2 weeks in order to be able to accommodate passengers. We do know that the hotels need 4 weeks to 6 weeks in order to be prepared. So, you know, I do understand that, and we do want everyone to have as much advance notice as possible. We're working really hard to do the travel bubbles because we believe that that's the first opportunity. We are looking at, on the domestic side, about, you know, whole notion is, can we require people and do a travel bubble by people getting tested, and, you know, can we confirm that it's a valid test and all of those kinds of things on the domestic side. And, you know, we'll be making that announcement as quickly as we can.
All right, Governor Ige, thank you again for spending your Monday morning with us, and we look forward to another update next week, and we will get an update from you then. Thank you.
Thank you. Thanks so
Aloha.
much for having me. I appreciate it.
Thank you. We
Thank
will
you.
see you in a week. Interesting there, Ryan. So, if there's a 2 to 6 week lead time there, we are not seeing travel open up from the mainland anytime soon. And then that's sort of what we were expecting, that this neighbor island opening is like I said, this the test case. And then from there, we have to see how it goes. But, he definitely ruled out June, and it doesn't sound like July, as much as Mufi Hanneman and HTLA and Peter Ingram and all the airline executives would love for that to happen. It sounds like the governor is working on a much more conservative timeline. Yeah,
we just have to kind of wait and see. And again, a lot of that will be driven by numbers and being driven by what happens with some of the counts that we continue to see. And actually, we have another guest joining us right now to talk exactly about those numbers.
Yeah, that's right. Dr. Victoria Fan from the Hawaii Pandemic Applied Modeling Working Group is joining us. She's part of the Hawaii Data Collaborative. We're so happy to have you on this morning. Well, first of all, just so that our viewers understand, tell us a little bit about HiPAM, what it is, how it came together, and what you folks are doing.
Sure, and just a clarification then, I'm actually from the University of Hawaii. I'm not from the Hawaii Data Collaborative. They are a very core, essential member of our, we call it HiPAM, the Hawaii Pandemic Applied Modeling Work Group. Early on in March, we saw that there was a lot of interest to bring scientific expertise to help inform the public health response to COVID. And so we convened together a voluntary group, or just all volunteers. But basically, it's about 25 applied epidemiologists, data scientists, health professionals, who all want to bring their scientific expertise to help the state make the best decisions possible. So we're trying to, the purpose of HiPAM is to use our epidemiologic knowledge, and as the data is constantly changing all the time, keep abreast of the new knowledge to help make the best policy decisions for the state.
And what are some of the things that you folks are seeing right now as you guys have gotten together, maybe trends, any sort of information that you might be able to share with those tuning in about some of the information that you guys have been able to gather thus far?
Yeah, we have been fortunate to take advantage of, knowledge is so global these days. We've been taking advantage of so much information globally. There are so many models that are built at Stanford, MIT, Johns Hopkins, and those models are really informative to help us plan through different types of scenarios in terms of changes in letting in more travelers, or trying to get a sense of how much the hospital bed counts would be, at capacity with more cases. But there are challenges with using these, global models because they're not using Hawaii-specific data. So.
Tell us a little bit about what our unique challenges are. I mean, we know that we're an island state, and we have the X factor is the visitor. But as we try to take those numbers and apply it to our situation, what are the flaws in that?
Hawaii is so unique compared to the rest of the United States because we are so dependent on tourism and those inbound travelers. So being able to get a sense of, the faucet, so to speak, of COVID cases is really from the travel. And so getting a sense of, how many new COVID cases are or would we be getting from any amount of inbound travelers is essential. And in order to do that, we would need to do more testing and get the data for that information.
How are these numbers and some of the things that you folks are uncovering through your kind of work together influencing the state, and can the state be more integrated into some of the numbers that you're providing to help them sort of make these decisions?
Yeah, so we have a really great group of scientists who are involved in their different capacities, advising some of our high-level leaders through the Hawaii Emergency Management Agency, some folks from DOH. We even have some folks from Queens who are actually planning, the bed surge capacity issues. So individually, our members are sort of working in their own capacities, but as a group, we sort of have just really rich discussions as we plan through and think through the different kinds of strategies, whether it's, should we be doing more testing of inbound travelers? How much is that going to affect our case count? How should we think through, improving the effectiveness of our contact tracing?
We always like to bring in the viewers. Ingrid Peterson wants to know, what about Hawaii's Aloha Trace data? She says she's been putting in her info every day. There are these programs in place where people can actually do their own sort of self-reporting. What do you think about those models, and should more of us be doing it?
Yeah, absolutely. I think that's an effort also within the University of Hawaii, and I applaud any types of effort which help us to get more real-time data. The biggest challenge of COVID-19 is that the majority of cases of COVID are asymptomatic. The evidence base suggests it's around 60% of all COVID cases have no symptoms whatsoever, and those people can be spreading diseases. So using a measure to just track symptoms has some limitations.
Okay, and maybe moving forward, what are your hopes for helping to sort of gather this information? What are some of the things that you folks are hoping to do with this information that you guys are collecting to help to influence maybe policy and decisions that are made down the line? Because we're going to enter an important time where data is going to be more important than ever as we see more visitors and the state open up.
Yeah, we're doing our best to help advise and work with the Department of Health to help the state use data to inform the public health control efforts. And arguably the testing data is important, but that only gets us information about those positive cases. And arguably the more critical data source is on the contact tracing data. So from one case of COVID, that can spread to 2 or 3 cases, and those might not necessarily be captured in the testing data. So the contact tracing data is really essential, and being able to use that data to improve the effectiveness of contact tracing is just so crucial. What's the delay between, say, testing and actually tracing those contacts, and then from there informing those contacts that they need to self-quarantine. So the ability to use that data in a real-time and timely manner is just so crucial to improve the effectiveness of our contact tracing system.
Without an adequate real-time contact tracing system like you're talking about, could we be facing another shutdown?
I think that's been the hugest challenge for the entire country, is that in the absence of a very strong and targeted contact tracing system, we've had to sort of default to these statewide quarantines, which are these shutdowns. But some places like Taiwan, they've been able to use these very targeted measures by saying, okay, well, we're able to find certain positive cases, and then from there trace those contacts. So this individualized home quarantine approach can be very effective and less with fewer devastating economic impacts if we do it well. So it's just so crucial that we really invest in this public health response.
All right. Well, Dr. Victoria Pham, thank you so much for taking time for joining us today and sharing that information. It's always great to hear about some of the things that are happening sort of behind the scenes. We hear these numbers, we see these types of statistics, but it's great to actually know and put a face to some of the names and the people that are actually doing that work. So thank you so much for all that you're doing.
Thank you for having me.
Thank you.
Thank
Aloha.
you. You can learn more about the Hawaii Data Collaborative at hawaiidata.org. We threw up that URL right there, so check them out. They've got some great models on their website, and you don't have to be a scientist to understand them. They're very accessible, and we've invited them to join us every Monday. We're going to have a different guest that is part of the Hawaii Pandemic Applied Modeling Work Group to talk about how they're using science and how they're using data to help, as Ryan said, influence policymakers, because at the end of the day, we all want to keep COVID out of our community, and the way to do that, of course, is with good science.
Yeah, and of course, we will continue to keep you posted on who will be joining us again. That will be on Mondays. And we also have a number of guests already lined up for the rest of this week. We're going to be talking, of course, to a doctor on Wednesday. We'll also be hearing from Dave Matlin, the athletic director from the University of Hawaii, on Friday. And we also have someone from the Honolulu Board of Realtors joining us tomorrow, a timely guest based on a new article and statistics that were just released. There's a great article about it in the paper today.
Yeah, some really sobering numbers. Not surprising, but the drop in home sales and condo sales is pretty staggering. Sales of single-family homes and condominiums on Oahu tanked in May. That's not surprising. A lot of people practicing social distancing. Sales fell year over year, 22.5% drop. That was for single-family homes. For condos, it's a 51% drop. So, how do realtors recover? We know that Hawaii had, before the crisis, one of the hottest housing markets in the country. What does it look like now if you want to buy or sell property? So we're going to be diving into those numbers and also finding out some practical tips about how home buying and home selling has changed. We really look forward to the members of the Honolulu Board of Realtors joining us tomorrow. Of course, we always like to end on a positive note, and that is our Hawaii Hero of the Day. Today, we want to highlight Kupu. They have been preparing 200 meal boxes each week for 2 months for the families on the leeward coast of Oahu, distributed by the Boys and Girls Club of Waianae, given to the community each week. The next giveaway is this Friday, June 12th, from 3 to 5 at the Waianae Clubhouse. So mahalo to Kupu for doing that. For helping to serve that community. I know that those meals are needed, and we really, really appreciate that. Also to the Hawaii Produce and Seafood for helping to deliver those meals to families in need. This whole effort, supported by the Hawaii Community Foundation's Resilience Fund, Hawaii Community Foundation has been an amazing partner to the state in helping to make these kinds of things accessible.
That's right. So again, we want to thank our friends over there at Kupu for all that they're doing. They've been actually doing a lot throughout the pandemic, standing up some of these meal delivery services for schools. We know that that has also been a segment of our community that has been impacted in those lunches for kids. So they've done a lot during this time, and want to highlight them, and as well as all those who are continuing to do great work and needed work here in our community. Again, we encourage all of you to continue to tune back in here every morning at 10:30. We heard from Governor Ige. We saw many of the questions that were answered earlier on in our segment. Some of you asking, maybe you missed the first half. So we encourage you to head on back to the paper's website. There's a complete listing of all of these broadcasts that are posted after this broadcast ends. So if you missed any part of it or want to go back and watch, you can always find that on the Honolulu Star-Advertiser platforms. And again, we look forward to another discussion here tomorrow at 10:30. We, of course, want to thank our sponsors, the Hawaii Executive Collaborative and Hawaii Pacific Health, for making this conversation possible. So until tomorrow at 10:30, we will say ahui ho, and we'll see you then. Aloha.
Aloha.